Fainting is definitely there. Fatigue is the more common, but right there, fainting because of lack of blood circulation into the capillaries of the brain. Absolutely. So you can see where this becomes problematic, because it's not addressing the cause, it's just kind of looking at the symptom itself and trying to stop the symptom from occurring. So it suppresses the symptom. Meanwhile, once you go on high blood pressure meds, going off of them, it's kind of like taking a kid who's like hyperactive, throwing him in a closet for 3 days and open the door and see what happens. It usually comes back worse and rougher than it ever was before. So suppressing symptoms has a negative effect, invariably. The third difference then is that conventional Western medicine is unsurpassed in the diagnosis of health problems. Without question, as a matter of fact, we recently referred somebody to the emergency room after her first visit, refused to treat her, and she had a grapefruit-sized tumor in her abdomen that had to be removed, and we did not have the tools to resolve that, but we definitely needed tools in Western medicine to sort it out. And there are holistic physicians that we deal with on each side of town that we refer back and forth with. So most people have been there. She hadn't had a physical in the last 10 years. So, we kind of have to address each case uniquely, but you can see how that would go, right? So, basically, in Western medicine, it's often unable to effectively treat and resolve chronic conditions. Conventional Western medicine is most useful in treatment of acute crisis situations, whereas Oriental medicine is excellent in the diagnosis and treatment of long-term chronic problems. Additionally, many acute conditions may benefit from immediate Oriental medical treatment. For example, ankle sprains and the like heal rapidly if you treat them, but you have to catch them in the first 2 hours following the injury. As Priscilla was saying, it's kind of like a long-term chronic issue that had developed over time. Now, if you have somebody who comes in and they're an athlete, you get a teenager or whatever that twists their ankle, it's a lot easier to handle that 2 days after the event than 6 years after the event. Now they've had chronic ankle re-sprains and so on without strengthening of the tendons and ligaments in the area having occurred. The fourth difference then is that in conventional Western medicine, it's viewing the body as static and unchanging. By static as meaning stable and not able to change internally. Oriental medicine views the body as dynamic and capable of change in many ways. For example, it's common for a medical doctor to say that you have diabetes and you have to live with it, and then here's insulin, you have to give your shots for the rest of your life. And maybe that's the case and maybe it's not. An acupuncturist may say, let's improve the spleen and pancreatic system's function so that the body utilizes more of its own insulin to improve the diabetes. So in other words, having the internal function correct, causing the correct levels of insulin at the right times, would be a more optimal way of addressing, if it's possible. Sometimes it's too far gone, there's nothing you do about it, but that would be often the case that we see at the time. So the book explains how the body's function as it is from the point of view of Oriental medicine. It's recommended that you read chapter 1, and then there's a survey, and I'm going to have you guys fill out a survey. It's kind of like a make this interactive, but there's a survey in the book that you can fill out that categorizes the body in different symptoms that a person might experience. And then in chapter 2, that's where the survey exists, and then the main text of the book is really a reference, not necessarily that you would read this cover to cover. This isn't like a page-turning novel. This is kind of like, I read the first part, I understand the basic concepts of what, Oriental medicine is all about, and now I want to learn about how the body functions a little, and you can look at various symptoms and they'll show what's going on under the surface as the cause. Ideally, the treatment of a medical condition focuses, as I mentioned earlier, on the underlying cause of a health concern rather than merely addressing the symptom. To eliminate a symptom and its cause, partnership with professionals who utilize functional acupuncture in Chinese medicine is essential. So, there's a difference between treating function and treating symptoms, and that's really the key differences between TCM or traditional Chinese medicine and other forms of acupuncture that look at the reasons for the cause. So then the group that I work with, Acupuncture and Holistic Health Associates, we're over at Bayshore above Trader Joe's. This is the group, and you can see Morgan here. How about a round of applause for Morgan for taking time? And then, of course, we have my little sister Kit in the back of the room who's filming away. Round of applause for her. acupuncturists, Scott and David and I, and then case managers and people at the front desk and so on. So it gives you a feel for everybody. This woman in the lower left is Pat, who's a long-term patient's mother who insisted that she work in the office and created a job for herself. Anyway, she's cute. She walks to work, right? Yeah.
Is she there?
What's
there?
No. This is way past the time she would be out and about. She's great, though. Anyway, health is not just a word, it's a way of being. The background of training, there's a 4-year master's degree of science in Oriental Medicine to become an acupuncturist. The national board, they call us diplomates in Chinese herbology and acupuncture. Diplomate just means a specialist in a certain area of treatment of the body. We're also licensed in the state of Wisconsin as certified acupuncturists. We treat a wide variety of stress-related conditions, digestive issues, migraines, hormonal issues, and we're quite a few people since the mid-90s. Symptoms are something that can exist. You may or may not have symptoms. It doesn't necessarily mean you're healthy. Like a person could have high blood pressure and not even know it. So anyway, it gives you an idea. Now let's see what we got here. Okay, so I'm going to have you guys fill out the survey. This could be kind of fun. So what's going to happen is a few things. Let me just see what we've got going on. Okay. So what's going to happen is we're going to have you fill out a survey as we go. Maybe we can get the lights there more. And great, and then let's just make sure I've got enough of these. So for those of you, let's do this. You can hand this out. We're going to have surveys for everybody. So if you could hand out that to people who are currently patients, and then I'll hand these out. There's a couple of sides to this guy. And actually, Morgan, also need to be more of these on the back side. We're going to do this kind of fun thing with the survey, where you fill it out, and and then we have some pens too, Morgan. Right. You guys would enter in the drawing. Yeah. That's totally fine. No problem. Yeah, good. So then we just need a few more. Yeah. Just in the back of the room. All right, so what's going to happen is then you guys fill the survey, and then we're going to do a little game. We're going to do like, yes. Morgan, can you give one to Jocelyn? Okay, so just fill that out as we go. The reason for this is we're going to do, if there's anybody who's like in severe pain, we're going to do kind of a little interactive thing, experiential, and fill out this survey thoroughly from top to bottom, okay? And if it turns out that you're having pain right now, what you want to do is write down on the top of the survey what that pain complaint is, and then we're going to, probably like maybe just a couple or 3 or 4 people at the end. They'll take some time to do these little mini treatments. And it's like acupuncture but without the needles. And so, this tells me what I'm working on, and there's a consent form on the back. So this is the survey. There's 3 different reasons to fill it out. The first is that, basically it tells me what's going on with you, and if we do this little mini treatment, I can make sure that we get the best possible result. And then on the back, there's a consensus treatment that the state of Wisconsin requires for me to be able to do that. And then the second thing is we're going to do a drawing at the end. And when we're done with this, we're going to play a little Jeopardy. We're going to see if you guys catch on to this whole Oriental Medicine and You fever that we're going with here. All right, so anyway, if you're interested in seeing, if you have a specific pain complaint, you want to see if there's something we can do to help you out, make sure you fill out the survey front and back thoroughly. And then we'll go from there. So just fill that out as we go. I'll continue on. Okay, again, we go after the cause, and we're looking at the reason for the issue, not just the symptom. And when there's a block to circulation in the body,